Hello student, I will continue Oncology Nursing Part 2. In my previous video, I explained some of the points. Now today we will discuss about and we will see what is carcinogenesis. Carcinogenesis means transformation of normal cells into cancer cells. So when normal cells suddenly will not turn as a cancer cells, several stages are there. After one stage to another, finally it will become a cancer cell. So let me see what are that stages. The first stage is initiation. Second stage is promotion. Third stage is malignant stage. And fourth one is progression. So what's the meaning of initiation or stage of initiation? It means entry of a carcinogens. Carcinogens means cancer producing agent. In predisposing factor already we saw chemical agent, radiation, physical agent, lifestyle, certain habits, all that things. When a client continuously exposed to that particular cancer producing agent, for example, person is working in a chemical factory, he is exposed to, he is continuously inhaling that chemicals over and over. So what happened, this chemical cancer producing agent penetrate inside the body, inside the cell, and inside the cell is made up by DNA and RNA. So it will destroy the DNA. So DNA contain millions of genes. So when it destroy the DNA, simultaneously the gene mutation will takes place. Gene mutation means biochemical changes in genes. Genes are unable to control the cell's activity. So damage is irreversible. So it may lead to genetic mutation. So after that it moved to the second stage, that is the promotion. So what is promotion stage? Now the client continuously, the additional assault to the cells, already the cell is damaged, it's become weak, it is damaged. So again he is continuously exposing that same carcinogens as well as other carcinogens. For example, the client is exposing to that chemicals. Along with that, he has the habit of smoking, drinking, gudka eating. So what happens? The further genetic damage will takes place. From promotion to the third stage, it will move. That is a malignant stage. So malignant stage means what? At one point, the cell completely turned as a malignant. So cancer cell. So once it is a malignant, the progression means the cancer cells start to invade, compress and destroy an entire body. It will spread and leads to various health issues in a client. That is a progression. That's the final stage and very where the client will be having lot of health issues. So these are the stages of carcinogenesis. This may ask for 5 marks question. So whatever explanation I explained, you have to write it for exam. So now let me see what are the diagnosis of cancer. Okay, before moving on diagnosis, let me see the characteristic of normal as well as a cancer cells. So how the normal cell will be and how the cancer cells are differ from normal cell. There are several points are there. You can mute the video and you can write down all the points. Very important, for 5 marks they may ask. Okay, next we will move on. What are the diagnoses of cancer? How they will diagnose? When client approach the doctor in a clinic, what doctor will do when the client start to say that several things symptoms? The doctor will start to ask a history. History collection is the first part. So what history will collect? History of blood relative or a in family anyone are suffering with a cancer, genetic history, diet history means diet means whether vegetarian or a non-vegetarian or which is a prone, he eat junk food or a processed food, so all that. Work history, whether where he is working. Environmental factor means where he is staying, whether near any factory or many other things. Okay, then habits like smoking, drinking, gudka eating, so as well as many other history. So prolonged infection, kind of in a past, whether he has undergone for any surgery or taken a treatment for any disease, or prolonged he suffered with any bacterial or a viral infection. So all the history collection, he will move on a physical examination. Through the physical examination, the doctors will find out many of the things. So physical examination, there are 4 steps are there. Inspection, palpation, percussion and auscultation. So through the inspection, the doctor will find out changes in any color, texture, any lumps or abnormal growth, induration, discharge, ulcer. The second one is a palpation through the fingers. Through palpation, the doctor will find any lumps, tenderness, or any organomegaly, means enlargement of the organ. Through percussion, accumulation of fluid or gas or a mass. Through auscultation, abnormal sound. Through the abnormal sound also he will come to know many of the things. As well as when clients say the symptoms like weight loss, weakness, fatigue, central nervous system alteration, pain, hematological hematology and a metabolic alteration, headache, nausea, vomiting, lethargy. So apart from this history collection, physical examination itself, the doctor will not come to know, though he get the doubt also, to confirm that he need further more investigation. What is that? Lab investigations. That is a various type of a blood investigation, complete blood count, as well as a various other test, along with that tumor marker test. So what is tumor marker test? Tumor marker means it is a kind of a chemical released from the cancer cell itself, or it is released from the normal cell in response to cancer cell. So it is the tumor marker, the chemical substance is a kind of an antigen, or a antigen is a protein made by a cancer cell itself. So apart from that, imaginary studies, it may be a X-ray, CT scan, MRI, or sometimes surgery also required. Maybe the when doctor palpate, he could find some growth that is inside. To know whether it is a cancerous or a non-cancerous growth, the doctor has to open the abdomen and has to take a specimen. That is called as a diagnostic surgery. Through the diagnostic surgery, the doctor will diagnose whether it is a cancer, if it is a cancer also, whether it is a benign or a malignant. So hope student you understood this much. So remaining content I will explain in a next video, that is a part 3. Take it. Bye-bye.